Welcome to the Deep Dive. Today we're diving deep into a topic that touches so many lives. Chemotherapy. It's a powerful word, often synonymous with fighting cancer and offering immense hope.
Exactly. And our mission for you today, as we sort of unpack this stack of your sources, is to go beyond just the life-saving potential. We're exploring the profound challenges and, well, the often hidden side effects of these powerful treatments and what that truly means for a patient's quality of life. Consider this your shortcut to truly understanding this critical balance.
So as we dove into your material, one of the first things that truly stands out about chemotherapy's core mechanism is its fundamental paradox.
Yeah.
It works by targeting all rapidly dividing cells. Think about it, not just the cancer, but also healthy cells like those in your bone marrow, hair follicles, or the lining of your gut.
Right. And what's fascinating here, or maybe challenging is a better word, is that this non-selectivity, while incredibly effective against aggressive cancers, is precisely why we see such a predictable and wide array of side effects. It's the very mechanism of action that leads to widespread impact.
Like hair loss, nausea.
Exactly. Those common ones, but also much more severe complications too. It's inherent in how it works.
Okay. Given those widespread impacts, it's interesting how treatment has evolved, particularly with the rise of oral chemotherapy. On the surface, that sounds like pure convenience, doesn't it? You know, pills at home instead of IVs in a clinic.
It absolutely offers clear advantages. Reduced invasiveness, more patient control, often fewer clinic visits.
Oh, sure.
But, and this is a big but that comes through in your sources, it shifts immense responsibility onto the patient.
How so?
Well, this isn't just about remembering to take pills. It introduces this silent, often overlooked battleground where a patient's self-management becomes absolutely critical to the treatment's success or failure.
Right. Adherence.
Adherence is paramount. Underdosing or overdosing can severely compromise everything, the whole treatment plan.
That's a critical point. And the sources also mentioned something about patients not always reporting side effects. Why is that?
Yeah, that's a really perceptive question and a huge challenge. What's truly alarming is that patients frequently downplay or even hide their struggles.
Why would they do that?
Well, often it's maybe a desire not to complain or a fear of appearing weak or even, a deep-seated worry that if they report too many issues, their life-saving treatment might be stopped or reduced.
Wow. Okay.
So this creates a dangerous blind spot. It makes effective symptom management incredibly difficult if doctors don't have the full picture.
So these aren't just minor inconveniences we're talking about then. Let's maybe delve into some of the specific examples from our sources that highlight this profound and lasting impact.
Yeah, definitely. If we connect this to the bigger picture, many powerful agents have what's known as a dose-limiting toxicity, meaning there's a point where the drug's side effects become so severe that increasing the dose any further would be too dangerous. Even if, it could potentially kill more cancer cells, it's a balancing act.
Got it.
So, take Vincristine, for example. Certain drugs like this are notorious for causing nerve damage, what doctors call neurotoxicity. This can actually show up as severe jaw pain within hours of the first dose.
Hours. Yeah.
And even more profoundly, studies indicate that nearly half of patients, something like 47%, continue to experience peripheral neuropathy symptoms.
That's the numbness and tingling.
Yeah, exactly. Numbness, tingling, or pain in the hands and feet. They experience this even 6 years after completing treatment. 6 years.
That's astonishing. Really long-lasting. What about other examples from your research?
Well, consider methotrexate. It's a very common chemotherapy agent. It can cause something called myelosuppression. Basically, it suppresses bone marrow activity, leading to a dangerous drop in vital blood cells because it disrupts how cells make their DNA. And patients also often describe this pervasive mental cloudiness, what's sometimes called methotrexate fog.
Fog, like concentration issues.
Exactly. Memory problems, difficulty focusing. And these aren't just during treatment. The effects can truly linger.
So what does this all mean for long-term survivors, years after their active treatment ends?
Yeah, the impacts truly extend far beyond the treatment period itself. We see ChemoBrain, that persistent mental fogginess we just mentioned, memory issues, difficulty concentrating that can really affect daily life. Chronic fatigue is another big one, the kind that doesn't improve with rest. And perhaps surprisingly, there's also a heightened risk of secondary cancers later on.
Secondary cancers.
Yes. For instance, acute myelogenous leukemia, a type of blood cancer, has been linked to the use of drugs like etoposide. And this typically presents maybe 2 to 4 years after the primary diagnosis.
Right.
So these enduring health challenges, they deeply affect a survivor's long-term quality of life. It underscores the sheer endurance required.
It's a powerful reminder, isn't it? Chemotherapy is a life-saving tool. Yes, absolutely. But its effects are profound and lasting, often extending well beyond the active treatment period.
Exactly. And understanding this critical balance really underscores the continuous need for personalized risk assessment and for truly proactive symptom management and the ongoing vital quest for more precisely targeted therapies, ones that spare healthy cells from this collateral damage.
So for you, our listener, thinking about all this, what steps can you take? How can you be an even more informed advocate for yourself, or perhaps for loved ones, when navigating complex treatments like chemotherapy?